Okay, wait a minute. So, what do I not know that I should know?
You should understand that all the shit, all the frustration that led you to vote for Donald Trump in November is not the fault of the Democratic Party.
Well, whose fault is it?
The Republican Party.
Like what?
Like, okay, so the reason Obamacare sucks is because of concessions made to the Republicans because they needed Republicans.
No.
Yep.
This is a program that was doomed to fail. It was doomed to fail because of redistributive schemes.
To fail.
Nope. This was a terrible plan. Nobody wanted to see their insurance premiums doubled or tripled.
No, and
nobody wanted to see doctors pushed out.
Either.
I didn't know death looked so fashionable. What's up, Death? I didn't know you looked so fashionable. That's pretty.
Makes sense, and it's the right.
You look pretty lively to me. Are you gonna pour more water on him?
I'm not actually deaf. Saves money and saves lives.
What? I'll feed the troll.
This is so cool. What? Death's not afraid of anything.
Isn't he dressed nicely?
And a population size
I think so.
same as Canada.
Death is walking away from me. Come back here. Come back.
As awful and evil as it is or will be, will only make
What is it?
Therefore,
Maybe he's scared of me. You know, death should be scared. Death is an afterthought for me.
Scared death away.
I know, isn't that great?
So now I turn my words to Speaker Rendon. Mr. Speaker, we have a crisis in healthcare.
Yes, we do. It's called Obamacare.
In California and all across the United States, too many continue to die or go bankrupt due to medical expenses. A situation we know will only
I've got about 15 minutes, and then I got to go to Cudahy. I do. I'm energetic, dude. That too.
Buddy is a part of CNA, California Nurses Association.
Is that true? I'm just asking. California Nurses Association.
I don't want to say anything else that he can detail that I might say wrong.
Just correct for the record. No. You have a right to correct it. This guy knows the difference between the Congress and the Senate. I promise.
Hey, listen. It's been a long time since. Yeah.
Let's move over this way. We gotta get on the street. You have one job.
On the sidewalk. We don't want you to get in.
Well, thank you, buddy. He's my buddy. Hey, where did that guy go?
Anyway, I don't want to talk to him.
That's okay. You gotta go home?
I gotta go home. I don't want to leave you alone.
Okay, well, if I stay here, I should be fine. Yeah, these are not like the crazy open border freaks that I have to deal with on a weekly basis.
All right, Charles. Hey,
thanks a lot, man. What's your name? Greg. Oh, you're awesome, man. I've been trying to get in touch with you. Like, you're I did. We've gotten in touch before. Thank you.
You called me. My wife's disabled, so I'm kind of stuck at home for a while. But
yeah.
I'll show up once in a while.
Thank you for doing that. Thank you for being my angel.
You bet.
I agree with this too. Oh yeah. And I also agree that Bernie was robbed. I think they should investigate the DNC and Donna Brazile and Debbie Wasserman Schultz and Crooked Hillary. Lock her up. Lock her up. Lock her up. See people, give me a break. I can find some bipartisanship. Hey, what's up? I vote. I do too. Why do you support single payer though? But why? But why is it the right thing to do? Okay, healthcare equals freedom. I would agree it aids our freedom because we need to be healthy.
Yeah.
But I don't think single payer is the way to go.
You don't?
No, I think we need to get the government out of healthcare as much as possible.
But then it just opens it up more for the insurance companies. That's the problem.
Okay.
That's the problem.
Insurance companies are greedy, aren't they?
Right.
They are.
Yeah.
So what's the answer? Make them compete.
No, put them out. Yeah.
No, they had their chance. They've had.
See, here's the thing. Obamacare allowed 1 or 2 insurance companies to gobble up the market. We need 100 insurance companies, 1,000 insurance companies. That's what we need. Brotherly love.
Yes, I'm talking to a Trumpster here, man.
We can do it.
You gotta do what you gotta do.
Yeah, you gotta do what you gotta do.
We're allowing more insurance companies to take. We're allowing more corporations that can then take over.
What's wrong with competition, though?
How you been? Yeah, good.
Do you really think that they're competing against each other for what? For the American dollar?
Absolutely. What's wrong with that? Competition is a good thing.
To make money off people, sick people?
Well, doctors do that. Are you saying police officers profit off of crime, quote unquote? We talked about that.
Police officers.
But they do they not? It's their job to protect us, isn't it?
Getting paid a salary is not profiting.
It's the same thing for doctors.
I hate to say this, but police officers are socialized.
So is the fire department.
And when you say socialized, it's that everybody's paying into it. It's a public necessity. I agree with you.
K through 10, just like
Sure.
and they are socialist
Now,
society.
you mentioned education, but education sucks. It's terrible. Our kids deserve better than we get. And the way to do that is choice, vouchers, allow the parents to follow. Oh, I knew I was going to get some hostility for that one.
You don't want to argue with me about it. I think we should
Since Reagan got into it.
Oh my gosh, it's Reagan's fault.
It's not just Reagan, it's the Democrats too.
It's the Democrats and the labor unions that profit off of kids and parents. Heck yeah.
And the insurance companies that profit off of us too.
See, here's the thing. So, do you think that every one of us, so let's not have insurance. If there's a bill, I just pay out of pocket? Is that what you want?
If it were cheap,
So that means, okay, good. I agree with you. So here, how do we make it cheaper? Allow for lots of medical practitioners, allow for lots of insurance companies to compete. I can get whatever plan I want.
Insurance companies completely.
They don't compete.
Okay, so you would pay out of pocket.
They don't compete. They're all owned by the surety holders.
Okay, I'm going to have to focus on states. You asked about nations.
Hold on. Let me give you a little bit.
Give me a sec. I'm going to wrap this up because you asked a great question. Where is a nation that's an example? No nations, but states. You've got Tennessee, for example. They experimented with TennCare, total failure. You've got in the Big Bear City area, a hospital said no more Medicaid. We're going to do it.
Tennessee,
So,
is you know, on a scale of.
I'm sorry, I had to wrap this up. Thank you for patience.
What is their infant mortality rate in Tennessee?
I don't know. You have to tell me.
That would be a good statistic.
It would. Yes.
Because if you
Give me a
don't
sec.
I was thinking the more insurance companies you have, they don't really compete. They're all backed by the exact same surety companies that insure the bonds of all
Okay.
of the insurance companies.
You're bringing up a good point that needs to be addressed, which is that insurance companies have their own insurers, don't
They
they?
have surety companies.
Just like-
They all go by
yeah,
the same
sorry.
ones. They can't compare because the surety companies behind
Now,
them
here's the-
charge
no.
certain amounts. It's
Okay.
all a bait and switch, all of it.
Now, the reason
Look at surety
why,
companies.
so you've got, now think about this. The more insurance companies you have, let's go from like 10 to 1,000. So there's going to be different high risk pools behind them. That's how, but that's the nature of insurance.
The
So-
surety companies changing
Because, okay, so,
can't compete. It's
so
down.
let me go back to what you want. No insurance companies. You want single payer instead. So that means the government's the one paying for everything, right?
No, we are.
We are.
Okay, good.
But
It's out of our taxes.
It's cheaper. It's cheaper.
No,
than-
it's not cheaper.
It's cheaper than your
Yes, it is.
Trump care premiums are going to be.
I don't like the initial Senate proposal either, by the way. I don't like it either. It doesn't go far enough.
It's cheaper than private insurance is right
That's,
now.
of course it's cheaper because
It's
you're paying out of your pocket. But let's talk about the other costs. I've said this over and over again. You have women in UK who give birth to their children in hallways. There aren't enough beds. In
Now,
Canada,
did hear the
you have...
UK? The lady from
Hold
the
on,
UK.
hold on.
Where is she? I'll talk to her.
Hold on.
Yeah, she was over there. She just
In France, they come to your house and
I know, they bring the emergency room to you.
No,
It's cheaper.
No, that's not true. They come to your house and give you prenatal care to prevent any kind of.
We can have that too. We have that too.
No, we don't. No, we don't.
Well, why don't we though?
Because we have too many hands in the pie.
Exactly. And if you put government into it, there'll be
No.
even more.
We have too many
Are you
corporate
crazy?
hands.
I gotta confront this guy.
Yeah.
You didn't answer my question. You did not answer my question. Why you support single payer?
Sir, you're confused.
Why? No. Why am I confused? You didn't even answer me. Look at him run. We got another runner. Unbelievable. Okay. The guy wanted me to answer, but he won't answer me for some reason. I don't know why. I'm talking about him, not you, buddy. Your buddy. Did I blow you off? If I did, then tell me what I missed. Okay, let me get the scan here really quick. Getting out of the street, getting out of the street. Don't touch me. What's the matter with you? That's right, hide, you criminal.
Fuck you, man.
Is that your age or your IQ? I don't abuse my flesh. And besides, I have standards. Thank you. I'm seeing other people. So you're my bodyguard, thanks. Okay. Your sign is upside down. That's a nice sign though.
Do not engage the Trump guy for your own.
Do not engage the Trump guy. Wow, what is this? Was this like a apartheid state? Let me see.
No, it's a disclaimer.
So which do you? Okay, you want to save Obamacare, but then you want it to be.
I want to correct Obamacare. I want to work with what's already been in process.
Okay.
The work in progress.
So you don't want single payer.
I'm on. Definitely, I think that's the way to go towards. Absolutely. I
Okay.
think it's the solution all the way around. It'll suit everybody.
Okay, so if you save Obamacare, that isn't single payer. You want to go there though.
No, we want Medicare.
So that's not the same thing.
Of course it is.
Okay, so and it's always I have to go back to this. And who's paying for it?
Well, it's in the Obamacare.
Right. He's here to agitate.
My goodness, so much hostility. Can't I just talk? What?
Are you a business person?
So no, I'm not.
Okay.
I make money, but I'm not a business person.
So if you think about the cost that goes into healthcare, if you run a
Which is
small
too high.
business, you have to hire an administrator. No? You have to hire an administrator, insurance companies. There's a lot of overhead that goes into it.
I agree with you. It sucks. Why do you have a problem with me talking with other people, lady?
I think it's great. I want.
We need to do this. We've got to. And look, for example, one guy was telling me I need to understand the mindset. People are upset because they feel that people are profiting off of sickness. I respect that concern, but my answer is this: greed in and of itself. I mean, a businessman doesn't open up a business just for the out of heart. He does it to make money. You call that greed? Is that your definition of greed?
Healthcare should not be a business. Healthcare should not be a business. There are some things that we believe that are more important than the almighty dollar. And when
like
you
fire
have
departments and policemen.
Okay, but I want to hear from you. Okay, so I'm taking that train of thought I've heard from people, which is nobody should profit in healthcare.
correct.
Well, here's the
paid.
Okay, but that is profit, isn't it?
Okay, we have you know what? There's some things. There are
Okay.
things that policemen make money.
A salary. What you were talking about.
Okay, and so firemen make a salary and they do a benefit. Now, if you take the system that we had, people that could not afford to go to the hospital, like my best friend who had lupus, had a job, had insurance.
Yeah, I mean, it's outrageous.
In a crash, lost her job, would not go to the doctor because she didn't have the money. She
Couldn't afford
has
it.
lupus. She was literally dying, and we started paying for her insurance bills, a group of her best friends, because she couldn't do it. Obamacare saved her life. That's all there is to it.
Okay.
Pre-existing conditions, when you have them, and if you know people that have them, my son has asthma. The new GOP bill makes you put you into a pool where the CBO has scored it and said you
22 million will lose their health insurance. I heard that was the latest report.
Yeah, but when you start losing your insurance, if you have asthma and you have to decide between rent and having an emergency inhaler, sometimes you're going to choose rent and you can wake up in the middle of the day. So when people say die, they actually mean you.
I don't diminish that at all.
Yes.
I want to deal with the first thing, though. Okay, let me finish. Okay, we're going to lose trains of thought. I want to respond to this issue because I hear it a lot and I'd like to give a statement on it. So here's the thing. Insurance companies, for example, they're seen as a general boogeyman. People see them as profiting and not doing, I say boogeyman because they're doing such bad things, as people are saying. But let me ask you something. An insurance company is a service, right? They have to pay employees. Maybe they pay too many, but they have overhead, etc. Anybody who owns a business, they have to turn a profit to stay in business.
Why do we have that business in between?
So that's the first thing.
Why do we have a business in between?
Okay, well, here's my answer to that. How do we get innovations? How do we get new technology? How do we get new bright minds who are willing to invest? You have to have profit.
We want that too.
So, and what I'm saying though is, let me finish this part. I'm sorry, because you're understanding. I'm trying to get.
The answer to your question is, we fund also through the science. We have funded the pharmaceutical company. They make a profit. We fund a whole bunch of people with government money, and so that the idea is, and by the way, people's taxes would still pay for health care because people would, the money that they're paying right now for health care, they would pay more in taxes, but they would pay less in health care, so it would be a net advantage. However, to answer your question, so then the tax money that they'd spend would go to fund research and development. and the people that if you don't think science is in a company, so the idea that you should a scientist.
Okay.
Public universities are at the forefront.
I agree, but and you're bringing up there's a point people mentioned that there's the EpiPen scandal. They're way too expensive. You want to know why? Because you have regulatory burdens with lobbyists who tighten up the rules. I want to end that too. That speaks of liberty. That speaks of less government. If you're bringing more government into the picture, it leads to more tying up of resources. It leads, let me finish, it leads to higher costs. Do you know how many doctors and nurses fled from Canada to find better jobs here, higher salaries and less taxes? Read Star Spangled Canadians, you'll see the stats there. I don't think of them off the top of my head. But the fact is, you have a lot of medical professionals from other countries coming here to get a better wage. People want to make money. There's nothing wrong with making money.
You guys know that Trump has lauded Australia for their healthcare system?
And tell me about that system. I remember I'd asked you about it.
Yeah. Do you know that they have...
Tell me about it, though. What is it about it that stands out? In his view, because that's something I didn't listen to.
Well, as far as I understand, they have a single.
It's a single-payer system.
Yeah, right.
I don't know.
See, I'm not afraid to say I don't know. I'll look into it. The French system. I want to add this. The French system. What I like about it, they look to bring the emergency room to the patient as much as possible. They have a great system of you can't sue every time you get a toenail or something. They have a really good. People don't run to court every time. It's a tort-averse country. I do believe we should allow for lawsuits, yes, but it's out of control in this country. That's something I don't get to.
What fraction of the healthcare dollar is spent on lawsuits?
Too much. I could start with that.
Right now.
Because doctors have to buy this insurance to protect themselves in terms of liability. New York Times studied this. You had hospitals losing. They weren't able to afford their own liability insurance anymore because of Obamacare, which had jacked up prices, jacked up the insurance, had put a burden on these hospitals.
Okay, one thing that have a lot of agreement on the problems with Obamacare.
It's upside down, I'm sorry.
Yeah.
Oh, well. I'm going to wrap this up because I got to go to cut A.
Insurance company stock tripled after Obamacare.
That's my point. They profited from it. Doesn't mean I like it. It's wrong.
So
Absolutely.
You're putting more of those layers in between the patient.
No, I'm for choice. I'm for competition. So listen to me. When you have, insurance companies. So you have insurance company A, which is the boogeyman that wants to charge you to the hilt and give you nothing. Well, guess what? I ain't going to you. I've got 500 to choose from. Hey, this insurance company will allow me to buy a certain set of services, a certain amount with a certain pay, and there's competition there. I'm going to go with them. Okay. So then insurance companies have to go, let's see, if I actually want to make money, I'm going to have to actually give a customer what he wants.
Then why aren't the insurance companies, insuring people over 65?
Because there aren't a lot of them and they can get away with it.
They don't want to compete with a non-profit insurance company.
I agree with you.
Okay.
Look, cronyism is a terrible thing. I understand some of you are Bernie-crats.
Obamacare
was the croniest of cronies.
Wait a minute. Obamacare originally had a plan in it that was a government non-profit plan.
Public
like
option.
Medicare. Okay?
Public option, correct?
Yeah. That was vetoed by even the Democrats.
Oh, sure.
Because they did
Lieberman
not,
killed it.
Yeah.
I know, what's his name? The guy in Nebraska. Nelson killed it. Louisiana Purchase killed it.
So you're all for competition.
Yes.
But so you would be okay with a government option?
No.
Why?
Why? Because it's not competing for dollars. It gets subsidized immediately by taxpayer dollars, regardless of its performance.
Well, no. As more people,
so it's not.
As more people go into that system because they're not making profit, more people will be funneled out of the private system and into that one because it'll be cheaper.
No, it won't.
You don't have to pay the profits.
No, it won't.
Those other
and you guys talk about cost. Okay, so maybe people pay a set tax, but the cost is longer waiting times. The cost is more people getting sick, rationing, death panels. There was a gentleman, his story, it was so heartrending to me. This guy had he had stage 4 cancer, and they said, we're not going to give you the experimental drug. You're not worth it.
That happens with insurance companies.
So you want to make it worse? The government's going to be the insurer? I don't think so.
I would like to just say one thing to you that you said that was, see, if you're going to have a conversation,
I love Dana Rohrabacher.
If you want people to have a factual, wait a minute.
But I did, but I didn't like being overrun. I want to be able to say something.
You said we have better life here than we do. We're not. No. We're in the bottom of all the industrial companies.
That's not true.
It is true. Actually, it's true.
Get a Soviet stick. It's easier.
No, because I want to be able to be close.
The World Health Organization has stats on all the countries.
World Health Organization is so corrupt. They do not count stillbirths in Cuba to make it seem like infanticide is not as bad in Cuba as it is in the United States. They doctor the numbers because it's not true.
that you don't agree.
Not true. We agreed on a couple of things. Okay, I gotta hit it.
Hey, why don't you go interview